Hi, my name is Jessica Stafford, and I decided to do new grads nurses leaving within the first year. As I am finishing my senior year, leaving the profession is not on my mind. Unfortunately, that begins to happen with new grads as they start their career at bedside. Approximately 25% of new grad nurses leave their field of practice at the bedside. There are a lot of factors that go into these difficult decisions. One of the major issues that seem to be a common factor is new grad nurses getting patient loads much quicker than they expected, and more importantly, before they felt ready to do so. This is scary as a new grad nurse because we are trying to learn how to take care of patients along with learning the hospital policies, which puts overwhelming pressure on new grad nurses. This can put the patient's life in danger because nurses are not available to see change in patient status, and it puts the nurse's license at risk. Within the first year, on average, 18 to 30% of new grad nurses will leave their field of interest for a different environment or leave the profession altogether. In the second year, 37 to 57% will pick a different interest or leave the profession altogether. These are some scary statistics when you look at how many patients we admit in the hospital on a daily. There are simply not enough nurses to go around to care for the sick due to these conditions. Another factor that leads to new grad nurses leaving is not having proper precepting. This tends to be a pretty hot topic when it comes to new grad nurses working at the bedside. New grads are being precepted by nurses who only have had a year of experience under their belt as well. New grads report that having a great preceptor plays an important role in building their confidence and lessening their anxiety, which enables them to become more independent and assume a full workload over time. Nurse preceptors are seen on a significant resource to new grads who value their knowledge and teaching as well as their guidance and support. New grads leaving within the first year doesn't just hurt hospitals financially and destroy their matrix and staffing needs, it hurts the public as a whole. Nurses leaving means that there isn't a supply of nurses to care for the sick, which leaves short-staffed units and overwhelmed nurses. This can put patients more at risk for longer stays and getting the proper care to recover. Some things that we could do differently to help the new nurses transition to provide a positive work environment. Experienced nurses should engage in positive mentoring and orient, support, and educate less experienced nurses in the new roles or careers, as well as to help nurses love what they do and decide not to leave the profession. We have to do more as hospitals, co-workers, and older nurses to keep our new graduates in the profession. Proper education and being confident within their career can make a difference. When it comes to nurses and the profession, knowing what I do now, conducting the research that I have, I will keep in mind what it takes to make it and become a nurse and realize who it is jeopardizing if I leave the profession. As a new grad nurse, I will make sure I am properly prepared, confident in myself before taking a whole patient load on my own. Asking questions is key to becoming a great nurse and having the proper knowledge at the end of the day. I have spent a lot of time on getting my degree, and I don't want to jeopardize that and leave the profession after all the hard work I have done. Thank you.